Tibial plateau fracture and knee fracture, people. This was my knee, and 6 weeks later, this is what I was able to do. Let me show you an exercise, a stretch, and a bonus massage video at the end. That was what allowed me to dramatically increase my range of motion. This is what you need to avoid an MUA, a manipulation under anesthesia. You need to get your range of motion back, and if I can say the most 3 important things for you to do, it's move, move, and move. So watch this video, move along with me, do what you can, and let's get this range of motion back so you too can have results like CrossFit or dancing or just getting back to life in 6 weeks, not 6 months. All right, exercise 1 is find something that is not too high, lean on your crutches. My left leg was my broken leg, so even if you are still non-weight bearing, that's fine. Have your leg in the air. Lean forward, so make sure you have good balance. If you have a walker, you can use that. They don't use those in Europe. We just have crutches like this. Lean forward, get your foot on something like this, and then slowly start to lean back, because as you lean back, that's gonna start to bend your knee. And from here, try to stand as straight as you can. This is quite nice because you can use your crutches. You can get a little bit of motion in your good leg just to kind of move a little bit. You can squat down a little bit. You have the assistance from your crutches or your walker where you can move freely, basically. Sometimes I like to shift back and forth because this will kind of rotate my knee, which is good because we want to move that scar tissue as much as we can. And you can also, let's see if you can see it in the back camera. I believe so. Pick up your toe. This would be terrible. This is one of the most painful positions, but one of the most important to get downstairs. Because if you think about when you walk downstairs, which is maybe where either A, you already feel the pain, or B, you will when you're able to weight bear, you're gonna realize that this position is quite painful. This mimics that position. So when your foot is down, it's great for the quadricep, but when you get your toes down, if you want to call it like that, and you can rock back and forth, you will feel a very unique and disgusting pull. This is just some very unique scar tissue you need to work on. You don't always have the bounce. You can also just stay like this. A static stretch is, I think, a little bit better, more to relax the nervous system and get into the muscles, where I think a little bit more of this movement is great to get into the scar tissue and also the fascia. So do both. One is not better than the other. This depends on your knee. Every body is the same, but not everybody is the same. So we want you to focus on what seems to move the needle for you. For me, it was always a little bit of both. I like to keep my foot like this. I like to bounce. I like to hold it and breathe. And I also like to set my foot down and also see if I could start to move a little bit forward and bend into the stretch, because that then bends your knee even more. All right, for video purposes, due to the camera being over here, I've switched my leg. So now I'm actually standing on my broken leg. However, I want to talk about either A, a massage gun, or B, you just massaging your leg itself. What you're gonna realize is you're gonna have some areas that are a bit tight, that are painful when you get to a certain range of motion. With that, if you have a massage gun, you can work on those areas, and as they start to release, or if you don't have one, you can literally just use your hand. As they start to release, you will realize the pain gets better, and you're able to then go deeper. This is what you want to continue to do. Find those areas that are painful, work on them, release them, so it's like trigger points, and then continue to either drop deeper and or find a table, in this case, or a chair that is higher and continue to push your range of motion. Your range of motion will not push itself. You need to do that for yourself. If you don't, most doctors and physios will fail you. You need to do this on your own if you want to get the results. I can't express that enough. I don't want to be mean. It's just a little tough love so you get the results that you deserve and what you're supposed to, not the ones they forget to give you. All right, so this is the position I want you to start in, and I'm gonna show a picture right here. I don't remember the date, but I'm gonna put it there and say how many weeks after my surgery this was. But I was starting in a position just like this. I'm not sure which camera is better for which leg, so I'm gonna use the broken leg, my actual broken leg. From here, what I did was I just pushed my leg into a position in which I felt the pain, the trigger point, something blocking me and stopping me. From here, what you need to do is find that area, whatever it is, and work on it. So let's say it's the, I don't know, the middle of my knee here. So the VMO, vastus medialis oblique, this muscle here. Let's just say there's a trigger point there, because that's actually where the catheter was for me. And so I just work on that and I feel that it starts to slowly get better and release. Well, then what that allowed me to do was move it a little bit more in. And then when that happened, I probably felt it, well, I know for a fact I felt it in a different spot. So then maybe it was under my patella. So under my patella, we say Kniescheibe in German. What do we say in English? I think we just call it the, what do we call this in English? I say the patella, that's the actual name of the bone, but whatever. This area here, I'll put a picture there. And I started massaging it here because there's obviously going to be some adhesive tissue and scar tissue there because of the lack of knee movement in the patella. Mobilizations, which is one of the videos in my program I talk about, is great because that allows your knee, the patella, to remember that it needs to move and not get glued down. From there, I was able to go a little bit more. And then usually from here, you start to feel it pulling on the top of your knee. All of these areas make complete sense because you're not moving your knee like you should be, because for 6 weeks, you basically had to stay in bed. So this adhesive tissue is started to build up and it's preventing you from moving your knee like you need to. The problem is, unfortunately, for the thousands of cases I've seen with my clients, the physios and the doctors seem to forget the importance of this. Most people don't even have physical therapy for the first 6 weeks, and by then it's already a disaster, and then they start talking about MUAs, manipulations under anesthesia. Sure, that's fine, but when they break your knee, they're gonna have more swelling, you're gonna have more inflammation, and it's not the magical fix that people think it is. So you need to basically do the MUA slowly to yourself. So as you continue to massage like this, now unfortunately there, you won't be able to see it. So I switch right now to pretending my broken leg is my right leg, because then massage-wise, you can see it better here. So we're here, you're gonna start feeling pain everywhere. So now you can see in this camera right there, how I am working on all these different areas of my leg. I'm not doing anything special. I am literally just massaging the trigger point, just like this, or you can take a Theragun or a massage gun, whatever you have, releasing those trigger points, so then you can pull your leg a little bit farther. You should be doing this for minimum 20 to 30 minutes at a time. It takes time for these things to release, and as your leg goes in, it's not like it's gonna feel like rainbows and butterflies. It will hurt. That's okay. Sit there, breathe, relax, sit back, do whatever you need to do, because as the range of motion gets better, the way you can make sure that you're not injuring yourself is see how it feels in a few hours. You might realize, oh wow, I don't need my pain medication. This agonizing pain seems to be better. Yes, because you're releasing the scar tissue, you're opening up that adhesive fascial glue that you have there from not moving, and when your knee moves better, you move better, and when you move better, you have less pain, and when you have less pain, you have less problems, and you need less synthetic drugs that have terrible side effects. All right, if you have not joined my online program, all you need is an email to get started for 7 days, and you have a coaching call with me. It's that simple. The programs are on $40 a month. I know some of us are in different financial hardships, sure, but if you can't find, 40 euros a month, at least for 3 months for your knee, I don't know what to tell you. If it's really financially that's tough, I have a free Facebook group where I also go live and I post videos. This is your knee. This is your leg. You don't get another one. And if you do, it sucks. A fake knee is not what you want. You need to get it back yourself. So either do the work or simply, stop complaining and don't be surprised when your knee sucks for the rest of your life. The choice is in your hands. You have to do something. Sitting like this should not be your goal. It should be your reality. I can't stress this enough.